Hey guys, thanks for joining me today. My name is Matt Hepfel. I am the Associate Vice President of Marketing for Newtek Technology Services, and today we're going to talk a little bit about HIPAA as well as the HIPAA compliance solutions that we offer. So later on during the webinar, I'm going to have a couple of experts join us to answer some questions and to talk a little bit more detailed about the different parts of the HIPAA bill. But to get started, let's give a little bit of a background on the HIPAA bill itself. So the HIPAA Act was created in 1996, and it was designed to provide some guidance for security of healthcare information. It was released with lots of fanfare, and everyone studied it and took a look at it and tried to figure out how it would affect their organization. Well, because there was no enforcement provision and there was no agency that was tasked with oversight, it quickly became sort of ignored. Basically, because it read like kind of a manifesto. It was long, it was wordy, and there was lots of things in it that were about privacy and how you had to get consent for patients and collect and use and share their data, but there was not a lot of real solid guidance in terms of security control because it was based on more of a risk assessment approach, which back in 1996 was not very popular in the United States. Well, things kicked along for a while and not much attention was being placed towards HIPAA. And then about the mid-2000s, we started seeing more and more records in doctors' offices and medical facilities being made electronic. Doctors are trying to get away from hundreds of pounds of paper in their office and move to a more computerized system. Well, with this change, obviously, we saw more and more information being breached and compromised. And it was at this point that the government looked around and said that there's something missing here. Something's not right. So in 2009, the HITECH Act was appended to the Recovery and Reinvestment Act. This was when the economy went haywire, and they put together that rescue plan, and they tacked on the high-tech onto the end of it, and what it did for the first time was give agency oversight to the Department of Health and Human Services, but more specifically to the Office of Civil Rights, or OCR. So the OCR was specifically given the ability to enforce the HIPAA requirements as well as levy fines for any infractions. So suddenly people got very interested in how they could be compliant, how they can get their organizations compliant, and what they could do. So there's a period of time for about 2 or 3 years, people were kind of scrambling to try to figure out what they had to do, trying to find a checklist and just basically scrambling to figure it out. Well, because there was no checklist, there was still quite a bit of confusion. So in 2012, the Office of Health and Human Services issued an audit to try to see what was going wrong and see how HIPAA was being handled. Well, as a result, they found some definitive problems. They were still seeing breaches of data, or PHI, and other problems when it comes to third-party firms or business associates. Based on those findings, the government added the omnibus rule to the HIPAA bill in 2013, and it basically expanded and clarified the role of business associates, or BAs. It basically helps these companies and helps keep them accountable for breaches of data. So, we started in 1996, and there have been multiple changes since then. So, to really understand HIPAA, you have to understand the history. So while HHS, and more specifically the OCR, is the main agency with regards to oversight to HIPAA, there are others that play a role in the HIPAA as well. One of these is the FDA, or Food and Drug Administration. Now, they have always had the ability to approve pharmaceuticals for the use in the United States. Along with this, they have overseen and had the ability to approve medical devices for use to make sure that they are effective and distributed safely. Well, with some of these changes, they have expanded the definition of medical devices to include software. This plays a role when it comes to the HIPAA because medical software can hold and store data, and if you are a company who offers this software, then you must apply with the FDA rules and regulations as well as HIPAA. Also, the FTC, or the Federal Trade Commission, has advertising rules. They have indicated that they are going to be more observant of claims around HIPAA compliance that are being made in the marketplace. So if you are a company that is offering software or some other product that helps people manage FI, then you need to be aware of their advertising rules when it comes to what you can or can't say in terms of claiming to be HIPAA compliant or not. So one of the most interesting things about HIPAA is that there actually is no official HIPAA certification. So there is no person you can bring an issue to and get an official stamp of approval. And according to the OCR, they never plan to sponsor any official recognized certification program. I mean, they have published their audit protocol. They leave it vague intentionally. They want it to be able to look at different cases on it on an individual basis when it comes to HIPAA. So there are pieces of the rule there, the security rule, the privacy rule, and the breach notification rule, and they want to be able to leave it relatively vague so that they can look at each case as an individual basis. So other than those three rules I just said before, the privacy rule, security rule, and breach notification rule, there is something that companies usually do to try to become HIPAA compliant, and that's to get in terms with the Health Information Trust Alliance, or HITRUST. Now, they're a separate company. They've created the CSF, or the Common Security Framework certification program. So they basically create checklists for HIPAA. Now, these aren't officially recognized checklists, but what they do is that they take different companies and different businesses and they will create them checklists of what they should reasonably have done to keep themselves HIPAA compliant. So it's not an official stamp, and you still could have problems even if you comply with these checklists, but these are just checklists that are built to help companies maintain HIPAA compliance. So HIPAA is not just something that you need to worry about when it comes to patient information specifically. HIPAA can apply to all parts of your business, and it impacts every part of your organization. It can impact your human relations department, your billing, your IT, your customer service, anything that has any information in regards to information must be HIPAA compliant. So all kinds of records must be secure. Your internal processes and procedures have to be secure. All those processes that you do inside of your software must be secure. And any third-party companies that you contract with in regards to this information, they must be HIPAA compliant as well. So HIPAA is not just about one thing. It kind of is an overreaching, very large entity in itself. Alright guys, so I'm sitting here with Jay Lambert. He's the Senior Server Administrator here at Newtek Technology Services. And he's going to answer some questions for me today about the 3 different rules involved with HIPAA, as well as some things that Newtek does to help companies become HIPAA compliant. So how you doing today, Jay?
I'm doing well. Thanks for having me here today.
Yeah, no problem. So to get started, let's talk a little bit about the 3 rules. So we're going to start with the privacy rule. Can you talk a little bit about that?
Sure. The standards for privacy or of individual and identifiable health information, or the privacy rule, was actually established for the first time as a set national standards of protection for certain health information. The United States Department of Health and Human Service, or HHS if you know them that way, issued the privacy rule to be implemented as a requirement during the HIPAA in 1996. Now, the major goal of the privacy rule is to ensure that an individual's health information is properly protected while allowing the flow of health information needed to provide and promote high-quality health care and to protect the public's health and well-being.
So, in layman's terms, it gives patients rights over their own information.
Absolutely.
Awesome. So secondly, let's talk a little bit about the security rule. I know it's different, but they have a lot of similarities between those two. Can you give me exactly what the security rule entails?
Security rule entails is actually boiled down to an acronym that we know in the security aspect called CIA. You have your good CIA, which is this, and your bad CIA. Right. But this CIA is referred to as confidentiality, integrity, and availability. Now, the security rule defines confidentiality to mean that EFI, or electronic protected health information, is not available or disclosed to unauthorized persons. Under the security rule identifies integrity to be that EFI is not altered or destroyed by any unauthorized manner, and then availability is that it is accessible and usable on demand by any authorized person.
So, when it says requires appropriate safeguards, what exactly does that mean?
What it means is that there are security measures taken so that only authorized personnel can use information, either access this information, and these safeguards are there so that it can prevent unauthorized access by unauthorized people. So I couldn't get a hold of your information without providing certain information or safeguards or checkpoints or however you want to describe them without actually getting it, and they're in place for that reason.
Great. So the last rule I want to talk about is the breach notification rule. So this one's relatively straightforward, I think, but can you give me a little bit of a synopsis on what this entails?
You're right. It is relatively straightforward. It's a rule on how to send out notifications on breaches, but in this case, a breach is generally an impermissible use or disclosure under the privacy rule that compromises the security or privacy of protected health information. And that actually comes down to 4 different parts: what, who, actual, and how much is affected. The what being the nature and the extent of the protected health information involved, the who being the unauthorized person who used or to whom this was disclosed to, the actual being whether the protected health information was actually acquired or viewed, and then finally the extent of which the risk to the protected health information is being mitigated. Now, there are exceptions to this rule, of course, but we don't have to go into those. But the notification rule comes down into 4 areas on how they're notified. First being the individual noticed, where the covered entities must notify the affected individuals following the discovery of this breach by either snail mail first class or email, assuming that the individual has agreed to receive such notifications. The second being a media notice, which the entities that experience this breach affecting more than 500 individuals need to notify a state or jurisdiction of media of how this happened, so that local residents can can respond on their side as well. Then there's the notice to the secretary. In addition to notifying affected individuals and or media where applicable, covered entities must notify the secretary of breaches of unsecured FI information. And then finally, there's notifications by business associates, which if a breach of unsecured protected health information occurs at or by a business associate, the business associate must notify the covered entity following discovery of the breach.
Great. And similar provisions are enforced by the FTC as well, I believe.
Absolutely.
All right, great. Thank you. So can we talk a little bit more about what Newtek does to help maintain HIPAA compliance for companies?
We do offer a service called Managed Services, where we keep our servers up to date with the latest security updates for software and firmware. We also provide a secure and reliable platform built for rapid expansion without risk of compromise to the infrastructure supporting the environment. And we also, with that, we cut off a lot of the administrative functionality to the end user so that they can focus on their software without having to worry about the day-to-day complexity of the server administration, while still having the feeling of security in their IT infrastructure.
Okay. So to get into more the nitty-gritty, can you talk a little bit about what kind of technology we use?
Well, we're using current technology, up-to-date technology. So right now we're using Windows 2012 R2 operating systems with Hyper-V and virtualized guests. We encrypt our drives with BitLocker, which comes with that, and we use Active Directory domain services on our technology as well. And on the network side, we use Sophos UTM, which is a unified threat management. That is virtual firewall.
Okay. So is this the same as the servers that we use, or is that something different?
That's actually the software side. As far as the hardware side for the servers that we use dual Xenon Sandy Bridge EPs with 1 terabyte solid state drives in a RAID 1 configuration and 32 gigabytes of RAM. The virtual sides of these servers, the design is set so that the hardware virtual config is dependent upon the client's needs. The setup can exist on several physicals or just one. And then on the network side, we still use the Sophos UTM firewall controls most of the firewall restrictions for the hosts, as well as the inbound VPN if necessary.
Awesome. All right. Well, thank you so much, Jay, for joining me today. I think we got a lot of information out of that.
Thanks for having me here.
Thanks. All right, so I'm sitting here with Allie Lunsford. She's the Newtek insurance agent at our division, and we're going to talk a little bit about technology, professional liability insurance, cyber insurance, and some of the things we offer. So, Allie, can you talk a little bit about technology, professional liability insurance and what it entails?
Sure. Basically, it is a coverage that protects you in your capacity as a consultant when you're dealing with companies that are maybe IT companies or software companies, or they do database administration, things like that. It's basically when you're consulting them in their business in the scope of work that you would do for those clients.
So it's basically like if you say you're going to do something and you're unable to meet those goals, it protects you against some kind of suit or the company coming back at you for not doing what you're told.
Exactly. If you tell a company we're going to build you this super bomb website and it's going to reach 1 million people a day and you're going to have, a million hits a day, and then your work doesn't deliver that, you're basically liable for telling them that you were going to make their business out there in the storefront. Maybe it's for search engine optimization. Maybe they're not getting the hits that you promised them, and now they're looking to you to find out why their phone's not ringing. So
okay,
it covers you in a professional sense for the consulting that you do in your day-to-day.
Interesting. So other than the technology professional liability insurance, there's also cyber insurance. Can you talk a little bit about that and actually the difference between the two as well?
Sure. It's often purchased as part of a technology professional liability policy. Cyber liability coverage is designed to protect IT businesses against liability and expenses arising from theft or loss of data, as well as liability and expenses arising from a breach of data security or privacy or HIPAA, particularly when you're hosting client information. So
you touched on it a little bit. That cyber insurance can cover you when it comes to HIPAA data breaches as well, correct?
Definitely, yes. The government requires that if you are a doctor's office or a hospital, that you're HIPAA compliant. HIPAA compliant means that you are storing proprietary information. Maybe it's health information, social security numbers, email addresses, personal information of your patients and or clients. If someone breaches that and their information is out there, it could cost you hundreds of thousands of dollars to contact all those people to let them know that their information has been compromised through your system. And you could be looking at paying for credit monitoring for 2 years for each one of those patients that their information got out. Not to mention the fees and the fines that the government's going to impose on you for being breached.
And cyber insurance would help cover some of the costs from some of those breaches.
Absolutely, yes.
Awesome. Well, can you talk a little bit about the two different bundles that you offer, the Newtek small one and the larger one?
Sure. We have two products that we're offering to most businesses that are in these target classes. There's the Microtech Pack and the Super Tech Pack, and basically each policy gives you coverage for personal injury, failure to prevent unauthorized access, malicious code, intellectual property. It's basically a business owner's policy for a technology company. We could write the smaller one for as low as $995. The higher one is around $1,200. It just depends on what your sales are. They include errors and omissions coverage, general liability, business personal property, and sometimes you can even get a $5 million umbrella with that if you need it.
So the difference between the two is how much your sales are?
Yes.
Okay.
Yes.
Great. Well, thanks, Allie, for sitting down with me, and we're going to continue on. Thank you.
You're welcome.
Well, thanks for joining me today, guys. I hope we learned a lot. If you have any questions, you can always email us at techsales@thesba.com. That's techsales@thesba.com. Or you can give us a call at 1-866-820-8910. Thanks, guys. Have a great day.